Amebic liver abscess. Definition: Amebiasis is an infection caused by protozoan Entamoeba isolatica. It is transmitted through fecal-oral route. The infection can manifest ranging from an asymptomatic state to liver abscess. Amebic liver abscess is the most common extraintestinal manifestation of amebiasis.
I am going to discuss about amebic liver abscess. They are caused by spread of Entamoeba histolytica from intestinal lesions. The tropocyte form of amoeba in the colon invade the colonic mucosa, forming flask-shaped ulcers from where they are carried to the liver in portal venous system. Amoeba multiply and block small intrahepatic portal radicals, resulting in infarction necrosis of adjacent liver parenchyma. The patients, generally from tropical and subtropical countries, may have history of amoebic dysentery in the past. Cysts of Entamoeba histolytica in stools are present in only 15% of patients of hepatic amebiosis. Symptoms include intermittent low-grade fever, pain and tenderness in liver area. Coming to the lab diagnosis, a positive hemagglutination test is quite sensitive and useful for diagnosis of amebic liver abscess. Coming to the morphological features, amebic liver abscess are usually solitary. They are mostly located in right lobe and posterior superior portion. They are usually in the size of an orange. The center of abscess show large necrotizing area having reddish brown pus resembling anchovy or chocolate sauce. It is a gross feature of amebic liver abscess, showing single abscess which is irregular with necrotic wall. Coming to the histology, necrotic area consists of degenerate liver cells, leukocytes, red blood cells, strands of connective tissue and debris. Amoeba are mostly found in the liver tissue at the margins of abscess. And PAS staining is employed to confirm the tropozoites of Entamoeba histolytica. And this is the histological feature of Entamoeba histolytica affected amebic liver abscess. Please like, share, comment.
Aladdin Creations. Entamoeba histolytica may cause dysentery. Identification and differentiate from cysts of other amoebae that do not cause disease may be difficult. So in this video I am going to discuss morphology of Entamoeba histolytica cyst. Entamoeba histolytica cysts are round shape and have up to 4 nuclei that characteristically have centrally located chromatoid body with typically blunted ends, uniformly distributed peripheral chromatin. Cytoplasm is yellowish-gray in color, after staining with iodine solution, granular and dirty appearance. Cysts usually measure 12 to 15 micrometers. Membrane is thin, regular and circular. Entamoeba histolytica cyst morphology, very similar to Entamoeba disper.
Applications in medicine. It's important to know about the areas with high rates of amebic infection like India, Africa, Mexico, and Central and South America. Approximately 18% of patients with this disease will develop symptoms within 2 to 4 weeks, including fever and right upper quadrant abdominal pain, with 10% to 35% of patients experiencing associated gastrointestinal symptoms. The diagnosis is based on the clinical symptoms and relevant epidemiology, coupled with radiographic studies and serologic tests. Optimal treatment includes the use of metronidazole followed by a luminal agent such as paromomycin. Rarely therapeutic aspiration is indicated.
Amebiasis is an infectious disease caused by a parasitic one-celled microorganism, protozoan, called Amebic histolytica. Persons with amebiasis may experience a wide range of symptoms, including diarrhea, fever, and cramps. The disease may also affect the intestines, liver, or other parts of the body. Amebiasis, also known as Amebic dysentery, is one of the most common parasitic diseases occurring in humans. Amebiasis usually produces in migrant workers, institutionalized people, and recent immigrants. Amebiasis symptom: mild symptoms, abdominal cramps, diarrhea, fatigue, excessive gas, rectal pain while having a bowel movement, unintentional weight loss, abdominal tenderness, bloody stools, passage of liquid stools with streaks of blood, fever, vomiting. Amebiasis treatment. Treatment depends on the severity of infection. If you are vomiting, you may need to receive medications through a vein, intravenously. However, because of the potential for disease spread, amebiasis is generally treated with a medication to kill the disease-causing embus. More severe cases of Amebic dysentery are additionally treated by replacing lost fluid in blood. Drugs used to treat amebiasis, called embicides, are divided into two categories. Luminal embicides. They include deluxe furoate, iodoquinol, metronidazole, and paromomycin. Tissue embicides. Tissue embicides are used to treat infections in the liver and other body tissues and include emtin, adrumptin, metronidazole, and chloroquine. Because these drugs have potentially serious side effects, patients given emtin or adrumptin require bed rest and hard monitoring. Chloroquine has been found to be the most useful drug for treating Amebic liver abscess. Patients taking metronidazole must avoid alcohol because the drug-alcohol combination causes nausea, vomiting, and headache. Amebiasis is a common disease, yet every individual needs unique treatment and care. We encourage people with amebiasis and their families to learn, as much as possible, about the latest medical treatment and approaches, as well as healthy lifestyle.
Pros and cons. Pros. For simple abscess, the prognosis is excellent. Cons. Complex abscesses and large abscesses can rupture and may be associated with a high mortality. An Amebic liver abscess may rupture into the chest, abdomen, or pericardium. Rare complications include inferior vena cava thrombosis, hepatic vein thrombosis, intra-abdominal mass. Issue apply in Ecuador. It's important to know about the history and physical evaluation, treatment, and the differential diagnosis, because Ecuador has a high rate of entamoeba infection. Conclusion. When an interprofessional team approach is undertaken, the prognosis for most patients with an Amebic liver abscess is excellent. To avoid complications like rupture into the lung, pericardium, or abdomen, Patients with amebic liver abscess need a prompt referral to an infectious disease expert for treatment. Current evidence reveals that drainage of complex abscess can improve outcomes as opposed to medical management.
Friends, this 21-year male underwent CCT whole abdomen for evaluation of his pain abdomen. This CCT showing the liver is marginally enlarged with multiple hypodense focal parenchymal lesions of varying size with enhancing irregular peripheral wall with central low density necrosis in the liver. The largest lesion measuring of 3.8 into 3.3 cm size located in the caudate lobe. With the associated hypodense perilesional edema suggestive of abscess formation. Hepatic veins normal. The right branch of portal vein is close proximity to the caudate lobe liver abscess. However, there is no interluminal thrombosis. There is also diffuse concentric interluminal wall thickening of cecum measuring up to 8 mm in the thickness. However, cecum is normally extended. IC junction is normal with multiple sub-centimeter size iliac mesenteric lymph nodes showing reactivation. With this all these findings, it is opined that it is having inflammation of the cecal wall of suggestive of amebic with multiple liver abscess.